This is Reggie from Restore Plus Physical Therapy, and this is today's tip of the day. When do you use hot and when do you use cold? That's one thing that a lot of my patients always ask, and they really don't know which one to use. So I want to give you a quick guide to know which one are you going to use. Let's first start with heat. When do you use heat? If you're feeling stiff or you feel that the muscle is tight, or even if it's a joint, you feel stiffness, you feel some spasm, you feel tight, and you feel you can't move, then you will use heat because that will help get more mobility. It will get more flexibility in terms of the tissues, get more blood flowing there. All right, so you can use heat when you feel that way. Now, when do you use cold? The old school mentality of using cold is you use cold in the first 24 to 48 hours. But nowadays, some experts are saying that that's not necessarily the case all the time. They have what they call chronically acute, meaning it's acute all the time because you're using it. Let's say, for example, you sprain your ankle. First 24, 48 hours, you use cold packs. After that, what do? I would recommend still using cold packs. Why? It's because you're still walking, you're still putting pressure, you're still irritating your ankle. Same thing if it happens to your shoulder. As long as you're using it and you're irritating it, I would still continue using cold packs because it will keep causing inflammation, and cold packs are your natural anti-inflammatory. So I would definitely recommend using cold packs with those. Or if you have swelling, you have bruising because of the injury, I would definitely recommend cold packs. All right, so that's in a nutshell, a quick way to know if you want to use hot or if you want to use cold. Please feel free to share this with your friends or family or people you know, so it might be helpful to them. And please feel free to comment below. Bye.